Quebec health officials are reporting 10 more cases of monkeypox, bringing the total confirmed cases in the province to 15. Last week, Quebec reported the first cases of the virus in Canada. The Public Health Agency of Canada said last week that it was already investigating about 24 possible cases of monkeypox in the country. Meanwhile, Toronto Public Health says there are 2 new suspected cases of monkeypox in the city. There is also 1 probable case of the disease that's under investigation. The rare disease comes from the same family of viruses that causes smallpox. Well, joining us now to tell us a little bit more about monkeypox in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Pleasure to be here.
So what do we know so far about monkeypox and how it affects the body?
Well, monkeypox is an extremely rare disease, a less severe cousin of smallpox. We know that there have been about 250 cases in about 16 countries around the world. And we do know that it's spread by close and prolonged contact with an infected individual. So there's an incubation period of about 7 to 14 days. The symptoms are typically flu-like with fevers, chills, exhaustion, headache, and muscle weakness. And then we see this widespread rash that appears. They're painful raised pox. They're fluid-filled and surrounded by red circles. Then those lesions scab over and resolve over a period of 2 to 3 weeks. So what we are seeing here is something very similar to smallpox, but just less severe.
Sounds like a condition no one wants, Dr. Raut. Now, these cases seem to be increasing since first being reported in Canada just last week. So should Canadians be concerned about this?
I think that's a very good point. Overall, what we're seeing is this is a disease that has been around for quite some time. We're talking about humans since 1970. So when we look at Canada, we would see the occasional outbreak here, but we do know that the risk of infection is relatively low. We'll probably hear more outbreaks coming in the next hours and days, but overall, what we're seeing is this type of smallpox is likely a 1% mortality rate, even in the most severe cases there.
And as you mentioned, this does come from the same family of viruses that causes smallpox. How does monkeypox compare to smallpox?
So now smallpox was really eradicated worldwide in 1980. It is also primarily spread by direct contact, prolonged face-to-face contact with people, as well as objects contaminated by infected fluids like bedding or even clothing. So with smallpox patients, become contagious as soon as they develop sores and spread throughout. They remained contagious until their lesions completely resolved there. Based on the information we're seeing so far, monkeypox is far less contagious than that, so there's less concern on that.
All right, well, that's good to hear. But how can people stay safe from contracting monkeypox this summer?
So that's a good question. I think the important thing here is, close contact with an infected individual is required for that spread of monkeypox. So infection can really develop after exposure to broken skin, mucous membranes, respiratory droplets, infected body fluids, or even contact with any sort of linen. So when the lesions have healed, the scabs themselves may also shed, which could technically be inhaled. So there are a couple of ways that we can see that transmission occur. So our public health is really advising similar things that we've heard before: physical distancing, frequent hand washing and masking, and all of these measures that we're really using to fight the COVID-19 pandemic.
And what steps should people take if they are infected with monkeypox, Dr. Raut?
What we know is isolation and quarantine work really well to limit the spread of monkeypox. The only issue is, we're seeing the symptoms prolonged for extended weeks. So unlike COVID-19, where we would recommend isolation for a shorter duration, for monkeypox, we would recommend the isolation be about 3 weeks. And that way we decrease the potential to be in contact with someone else who could get that.
All right, Dr. Raut, just about a minute left here, but what does the discovery of monkeypox mean for the COVID-19 pandemic?
I think that's a good question, and I'm sure we are hoping for no more pandemics in the future, but monkeypox with the world, I would say the world is facing a very different situation compared to the early days of COVID-19. Monkeypox is in many ways a known quantity. We have tools to prevent it as well, and we certainly know far more about it than we did when COVID-19 first struck. But both public health and general public have had a lot of practice taking in these measures, preventing infections in general from spreading. So I remain quite cautiously optimistic that despite any trajectory or increase, we're going to stay vigilant and stay on top of this.
I'm sure that's good to hear for our viewers. Dr. Abhishek Raut, Medical Director at Appletree Medical Group, thank you again for your time today.
Thanks so much.
All right, when we come back from the break, we turn our attention to the human rights situation in China. Stay with us. We'll be speaking with Dr. Charles Burton.